Now let's go.
At these times, there has been an increase in diversification in the evolution of our health departments, and this has been boosted with increased numbers of health innovation and invention, and especially those that are touching the health environment. And with this, we've seen an increase in misdiagnosis cases in our hospitals. So join me, Patricia Duko, your usual Bliss Health reporter, as we discuss misdiagnosis.
Now let's go.
Welcome on board, and let's discuss misdiagnosis. When the term misdiagnosis is mentioned, I know most of the people out there tend to only incline it to our medical practitioners, but misdiagnosis doesn't start there. Misdiagnosis starts when an individual has symptoms and they tend to relate them to a previous pre-existing disease, or relate the symptoms to maybe a disease they've had someone discuss about, and they've used specific precautions to actually approach the disease. And with this, the person ailing from symptoms tend to source the used means, the previous used means, to actually cure the disease. And with this, you'll notice that this happens without the consultation of any medical practitioner. Onwards, in our medical departments and hospitals, misdiagnosis is there. This happens with an increase in negligence by our medical practitioners and the insufficiency of our health system in the country. And do you notice that this has affected most members of our society to the extent where people get to points of sourcing medical health outside there? The effect of misdiagnosis sometimes leads to long-term diseases. For example, let's take a case scenario of a person who is suffering from headache. This person keeps taking medication related to headache, and by the time they actually get to acute stage and source medical attention, you notice that some of them are actually maybe on stage 4 of brain cancer. So misdiagnosis is not only the responsibility of our medical practitioners, but also the patients who actually are negligent to source medical attention on any symptoms they have, and keep comparing them to pre-existing symptoms or traditional forms of treating some existing symptoms. Comparing our current health system to that of previous days, you'll notice that there has been a lot of scientific effect, innovation and invention, and this has eased and boosted the functioning of this system. Of late, surgeries can be done, organ transplants can be done, and compared to previous days where such activities could not take place. So even though misdiagnosis happen, this doesn't mean that it's a death sentence. At times, misdiagnosis cases can be reversed, or they can be noticed late in time, and these patients can also be saved. But with this, we don't insist on misdiagnosis cases due to the ability to reverse them, but we insist on sourcing of professional medical attention and care. Actually, before we get too deep into this conversation, let's ask ourselves this question. When last did you hear of a misdiagnosis case around you, or in your society, or the environment that you're in right now? And secondly, what was the cause of the misdiagnosis? Was it as a result of the failure of our medical practitioners, or was it as a result of the negligence and lack of understanding associated with the patient?
Now let's go.
Sourcing data from a research done by medical students from Kenya University is that in every 100 patients in a day that visit hospitals countrywide, 2 of the patients suffer from misdiagnosis. One of the cases is always out of negligence by medical practitioners, while the other case is always out of lack of understanding and knowledge by the patients to seek medical attention as early as possible, and hence they go ahead to take medication without the knowledge of what they're treating. victim. This has been highly related with the malfunctioning of our health system, and with this I mean lack of proper diagnosis equipment in the country, poorly trained professionals. In this I mean both the primary and the secondary medical care doctors, lack of well-modified or technologized equipment in our hospitals and labs, and negligence by patients on the importance of sourcing medical attention from medical practitioners every time they have a symptoms or a recurring symptoms, and they stop referring it to a previous symptom that they had treated earlier on. There's an interview that I came along from a Kenyan local television station, Switch TV, done by Tamima, that actually caught my attention to decide to discuss misdiagnosis in the country. Just take a look on this.
After convulsing 3 times, they rushed me to hospital. And they did a CT scan and they saw this growth coming from the inside of my head, right round about my spine. And so they did something called a biopsy. They opened my head up from here. And they cut whatever little something they could cut to study it. And after studying it, they came up with a conclusion that I had cancer. And they started the cancer treatment. But I didn't get better. I didn't get any better. And I was always in ICU, HDU, because it wasn't cancer. And they did the second biopsy. And they still came up with cancer. Did up to biopsy number 3 when one of the doctors said, no, this cannot be, something is wrong. The last biopsy, they decided they needed help from outside. Camry sent back immediately and says, no, she does not have cancer, she has TB.
It is time we cut the blame of misdiagnosis away from our health practitioners. The deficiency related to our health system, lack of well-equipped hospitals and laboratories, and understand that health is a responsibility of every member of the society. Hence, everyone needs to take part in the chase and run against misdiagnosis cases in the country. As I bring this discussion to a conclusion, I want to urge every member of the society out there to actually become a warrior in the race against misdiagnosis. Have been your host, Patricia, the until next time to us meet. Thank you for keeping locked.
Now let's go.